Hi, I'm Dr. Alexis from the Slim Samurai Media Group 84, helping you to slash through sickness and offering you a slice of health and wellness. Today's topic is glaucoma. Should I put down that cup of coffee? Glaucoma. Should I put down that cup of coffee? All right, before I begin, my samurais and samurettes, don't forget to click on subscribe, click the notification bell, like, send it 25 friends, comment so I know what to talk for future topics medically. Now let's look at this closely. Glaucoma affects some 3 million Americans annually and is the second leading cause of blindness worldwide. Open-angle glaucoma, the most common form of glaucoma, results in increased eye pressure. I can't tell you the number of times I went with my grandmother to the eye doctor and she had blurred vision, sometimes had pain, many times there was no pain, but she had elevated intraocular pressures, diagnosed with glaucoma, and this was late stage, so she lost part of the vision, was blind in her eye. So this is a matter that's very important to me. Now, let's get back to glaucoma. You often don't feel any pain in 50 to 60% of the cases. And that is the main reason why most people won't go to the eye doctor. It's sort of like hypertension. If you're not having chest pain, headaches, shortness of breath, most people won't take their blood pressure medication. Well, the same way when you have glaucoma, you won't even know you have it. You may not get any kind of eye pain or any blurred vision. Now, important fact to know, anyone can get glaucoma, but it's especially prevalent if you're African American over age 40. You're 6 to 10 times more likely than your white counterparts to develop glaucoma, based on genetics, based on various genetic polymorphisms, structural DNA. Now, all people over the age of 60 is another risk factor. People that have family history of glaucoma, that's a risk factor. Definitely people with diabetes, that's a risk factor. People with diabetes are often twice as likely to develop glaucoma than persons and individuals without diabetes. If you're in a high-risk group, you need to get a comprehensive dilated fundoscopic eye exam to catch glaucoma early and start the damn treatment. I speak from personal experience. Yes, having two eyes doesn't make you more of a person than an individual that has one eye, but it still would have been nice for my grandmother to have both eyes fully functional and not have gone blind in one eye. I always had a little tear in my eye for her when she complained about her vision. She was the sweetest woman that I've known. The sweetest, of course, next to my mother. And of course, my wife. I don't want to get a black eye and be put in the doghouse. But losing that sight ain't no joke. I discussed in prior videos medically what nutrients, what foods improve eye and ocular health so that you can have those eyes for the next 100 years. Now, what you can do with the diagnosis of glaucoma, obviously, number one, get treatment. Number two, those prescription eye drops the doctor prescribed, you need to take it on a daily basis. They can stop glaucoma from getting worse. They can't reverse it, but they can stop its progression dead in its tracks. Other important ways to stop glaucoma, well, if you smoke, you need to stop that damn habit. First of all, I'm tired of smelling that dirty cigarette smell. And number two, you're giving yourself cancer. Number three, you're going to get some damn glaucoma. So you need to stop it. Now, if you suffer from hypertension, take your antihypertensive medication. Now let's look at a study that involves caffeine consumption and the possible worsening of glaucoma. A team of researchers used a United Kingdom large-scale population-based database and analyzed the records of over 120,000 participants between the years 2006-2010, between the ages of 39 and 73. Now, these participants answered dietary questions. For instance, how many caffeinated beverages do you drink? How many of those caffeinated beverages you drink daily? How much caffeine-containing foods you eat daily? The type, and what's your portion of that caffeinated food? The investigators found high caffeine intake was not associated with increased risk for higher intraocular pressure or glaucoma overall. But having said that, we're not out of the woods entirely, because amongst participants with the strongest genetic predisposition to elevated intraocular pressure, that is, people that had intraocular pressure in the top 25%, greater caffeine consumption was associated with higher intraocular pressure and higher glaucoma prevalence. Those who consumed the highest amount of daily caffeine, more than 480 milligrams, which is around 4 cups of coffee, had about 0.35 millimeter mercury increase in their IOP, the intraocular pressure. Also, they're in the highest genetic risk categories of glaucoma: mother, father, grandfather, grandmother, for instance, who consume more than 321 milligrams of daily caffeine, or roughly 3 cups of coffee, had a 4 times higher glaucoma prevalence as compared to those who drink no or minimal caffeine. This is a very serious matter. You don't see no smile on my damn face. I miss my grandmother who passed away and who also had a loss in her vision. That woman worked so hard. I tried my best to do all my chores to make her job a little bit lighter. God bless you, Grandma Leader. You have blessed me your time that you have been on this earth. And I vow to you, Grandma, I'm going to make sure that people don't lose their vision. My samurais and samurettes will have 20/20 focus and 20/20 vision for now and for the rest of their lives. Enough said. I'm Dr. Alexis from the Slim Samurai Media Group 84, helping you to slash through sickness and offering you a slice of health and wellness. Be well.